What would you do if you had a stroke while alone at home? Imagine you're alone at home and suddenly feel numbness on one side of your face. Would you recognize the warning signs of a stroke? Would you know what to do in those first few minutes when every second counts and there's no one around to help? Strokes can strike at any time, at work, in your car, at the grocery store, while walking, or even relaxing at home. That's why it's vital to know how to act fast, especially if you're by yourself. In this video, we'll reveal 5 life-saving actions you can take immediately if a stroke hits while you're alone. You'll learn the unexpected symptoms that many people ignore until it's too late, how your smartphone can become your most powerful emergency tool, the surprising body position that could improve your chances of survival, a simple technique that emergency doctors wish more people knew. In the US, someone has a stroke every 40 seconds. A stroke cuts off blood supply to parts of the brain, and brain cells start dying within minutes. It's truly a race against time. Most advice on strokes assumes someone else is there to help. But many people, especially older adults, live alone. Knowing how to spot the symptoms and what to do right away can mean the difference between life and death. Have you ever experienced a stroke while alone? What did you do? Share your story in the comments. Now, let's dive into the 5 critical steps that could save your life when every minute matters. The very first and most important step to surviving a stroke alone is realizing that you're actually having one. This can be tough because strokes often affect your thinking, and your brain might try to convince you that the symptoms aren't serious. Denial is a common initial reaction. Medical experts use the FAST method to help spot strokes quickly. To check for stroke signs, look in a mirror or use your phone's camera and try to smile. If one side of your face droops, that's a warning. Next, raise both arms straight out in front of you, close your eyes, and hold them steady for 5 seconds. If one arm starts to drift downward, that's another red flag. Then, say a simple sentence like, "The sky is blue today," out loud. If your words are slurred, unclear, or difficult to form, it could indicate a stroke. If you notice any of these symptoms, act quickly because every minute counts. Beyond the FAST test, watch for other sudden warning signs like numbness or weakness on one side of your body, confusion, difficulty understanding things, sudden trouble seeing in one or both eyes, dizziness, loss of balance or coordination, or a severe headache with no clear cause. Recognizing these symptoms quickly, instead of ignoring them, could be the difference between getting help in time or suffering serious brain damage. If you notice signs of a stroke, call emergency services right away. Getting medical help quickly is the most important thing. This may seem obvious, but it can be hard to do if you're actually having a stroke. In the US, dial 911 immediately, even if you're having trouble speaking. Emergency dispatchers are trained to identify stroke symptoms. If you can, say the word stroke, but if you can't talk clearly, stay on the line. Many emergency systems can track your location even if you can't explain where you are. If you can't reach a phone or dial 911 yourself, try other ways to get help. Use voice commands on your smartphone like, "Hey Siri" or "Okay Google, call 911. You can also press the emergency button on your phone or press the power button rapidly several times on some devices. If you have a medical alert device or a smart speaker like Alexa, use those to call for help. If you live in an apartment or connected housing, try banging on walls or floors to alert neighbors. When you do connect with emergency services, try to speak as clearly as you can. Tell them you think you're having a stroke and give your exact location. Let them know if your door is locked, since responders might have to break it down. Describe your symptoms and when they started. Where you go for treatment is very important. If you can, ask to be taken to a specialized stroke center. These hospitals have the right equipment and protocols to treat strokes faster and better. After you call emergency services, your next important step is to make sure help can get to you easily when they arrive. This is often forgotten, but can save valuable time. If you can, unlock your door. Locked doors might force responders to break them down, wasting precious minutes. If you live in a building with multiple entrances or security gates, try to move safely toward the main entrance so responders can find you faster. If you're in a remote or hard-to-see place, make your location easier to spot. Turn on outside lights, open curtains or blinds, and position yourself somewhere visible, like near the front door or in a main room where responders will likely look first. Next, gather important information for the paramedics if you're able. Have a list of your current medications, your medical history, especially things like high blood pressure or past strokes, and contact details for your doctor and emergency contacts. Though these steps might feel less urgent when you're experiencing stroke symptoms, they can greatly reduce delays and help you get faster treatment when help arrives. While waiting for emergency services, how you position yourself can make a big difference in your condition. The main goal is to avoid further injury and complications. If you feel weak or dizzy, common signs of a stroke, it's best to lie down on your side instead of sitting or standing. This lowers the chance of falling and hurting yourself more. The best position is called the recovery position. Lie on your side, bend your top leg, and use your bottom arm to support your head. This helps keep your airway open. If you can, keep your head slightly raised with a small pillow or cushion. This may help reduce pressure in your brain for some types of strokes. Loosen any tight clothing like collars, belts, or anything that might restrict your breathing or blood flow, especially around your neck, chest, or waist. Most importantly, try to stay calm. Although it's not easy, stress and panic can raise your blood pressure and make the stroke worse. Focus on breathing slowly and steadily as you wait for help. While waiting for emergency services, it's important to carefully track your symptoms and how they change over time. Knowing exactly when your symptoms started is critical because certain stroke treatments need to be given within a specific time window after symptoms begin. If you notice stroke signs right away, try to note the exact time they first appeared. This can be vital for your doctors to decide the best treatment. If possible, use your phone to record the time your symptoms began, which symptoms came first, how they're progressing, and any actions you've taken, like medications or changing your position. If writing or typing is hard, use your phone's voice recording feature to verbally keep track of this information. Also, watch if your symptoms are getting worse, staying the same, or improving. That tells doctors a lot about what's going on in your brain. Make sure to mention any recent medications you've taken, especially blood thinners, pain relievers, or blood pressure drugs, since this influences hospital treatment choices. If you feel alert enough, set a phone alarm to go off every few minutes. This helps make sure you don't lose consciousness unnoticed and serves as a backup in case you can't call for help again. The details you record during this emergency can make a big difference in your treatment once you reach medical care. At the hospital, treatment focuses on restoring blood flow to your brain as fast as possible. For strokes caused by blood clots, ischemic strokes, doctors may use clot-busting drugs like TPA or mechanical methods to remove the clot. These treatments work best when given within hours of symptom onset, so quick recognition and action are essential. Recovery often continues long after the initial emergency. Physical therapy, speech therapy, and occupational therapy can help regain abilities affected by the stroke. The brain is very adaptable, and with proper rehabilitation, many people recover significant function. If you're at high risk or live alone, consider preventative steps like regular check-ins with family or friends, medical alert devices, or smart home tech that can detect unusual behavior. Talk to your doctor about stroke risk assessments. Now, we'd love to hear from you. Were you already familiar with these steps? Do you have any advice or experiences to share? Leave a comment below to help others be better prepared. If you enjoyed this video, please give it a thumbs up and subscribe for more tips, and we'll see you in the next video. Take care and stay healthy.